Hi, I'm Dr. Naveed Khan. Today we're going to be talking about what to ask your OBGYN or primary care physician regarding infertility. So the first thing that many people want to know is what tests to get done. There are three main things to look at in terms of a fertility evaluation. The first thing is to A, look at the male partner with a semen analysis. Secondly, look at the female partner by looking at the anatomy by a test called a HSG, which looks at the tubes in the uterus, and also to look at the hormones. The hormones tell us some very important things about ovarian aging. We look at the FSH, the estradiol, the AMH, and the antral follicle count on ultrasound. All those things together will give us an assessment in terms of ovarian aging, meaning that a woman can be X years old, but how old are the ovaries really acting? Also, people want to know what are the costs of these tests. Here in our office, we have a financial counselor that will tell you exactly what the costs would be, both for testing as well as treatment. Your OB/GYN will probably also have a financial person that can help you with that, obtaining that information. Many times men will ask, do I really have to get a semen analysis? And the answer is yes. It's a simple and easy test and gives us a lot of information. Half the time the problem can be male related. There's no symptom that anyone will have other than you're just not getting pregnant. So it's very important to get that simple test as part of the basic workup. So how long does the fertility evaluation take? Well, if it's organized, you can get it all done within a couple of weeks. From the onset of one's period, you can get the hormones checked, the anatomy checked, and the male can get the semen analysis done at any point. So really within 2 or 3 weeks, all this can be done and then reviewed, and then have a plan in place for the next cycle to move forward. So if you're getting treatment with your OB/GYN, many times they will use Clomid or clomiphene citrate, which is a fertility pill which helps one to produce more eggs. The pregnancy rates with Clomid are about 20%, or 1 in 5 women will get pregnant any single month. So you want to ask your OB/GYN what are the side effects. The biggest side effect is the risk of multiple, and sometimes women get headaches and moodiness while on it. And you want to ask how many months are you going to be on that treatment. We here at Shady we generally will put someone on fertility treatment such as Clomid for about 3 cycles, because that's a maximum time period when most people will become pregnant. So 75 to 80% of people will get pregnant within 3 cycles. And then at that point it's time to move on to something more effective or a different type of therapy. So if one gets their testing done with an OB/GYN, do you have to get it repeated again when you go see your fertility specialist? The answer is, well, if you've had most of the testing done within the past 6 months, more than likely not. But if it's been more than a year or 2 years, then some of those tests may need to get repeated, especially the hormones. So hopefully this has been helpful to you in terms of questions to ask your OB/GYN. If you have any other questions, please don't hesitate to either call my office or any of our Shady Go fertility offices, or you can look us up online at www.shadygofertility.com.